Hi, everyone. Happy Wellness Wednesday. My name is Claudia Wong. I'm the co-founder of Mindful Nurses. Thanks for joining us again for another Wellness Wednesday. Every week we have a special wellness talk or practice, and this is meant specifically for nurses. Of course, they can also be great habits and lifestyle changes that would benefit mostly everyone. But we have special presenters every week talking about a special topic that can optimize your life, reduce stress, and improve well-being. Mindful Nurses was created to help support the self-care of nurses through holistic wellness practices. So thank you for joining us. And today I'm really excited to talk about hormone balance. That's very important. I have Deborah Beaumont. She's from Oregon. She's an RN and functional medicine practitioner. And she specializes in helping women recover from breast cancer using a functional approach. She's a two-time cancer survivor who has struggled not only with cancer, but with the debilitating effects of cancer treatment. After her own experience, whole body systems-oriented recovery for women who have undergone such a life-altering diagnosis and treatment. So she's here to talk about how to achieve Zen balance in your own hormones. So thank you for joining us, Deborah.
Oh, thank you. Thank you for having me. I'm excited. This is an issue near and dear to my heart, not only hormones, but nurses and how we're taking care of ourselves or not, or the things that we need to know, because I think we have some unique challenges with the profession that we practice. And I'm really excited to talk a little bit about that.
Great. Yeah, I think it's a very important topic. I know nurses get very stressed and put stress on their hormones and can work night shifts and throw things off, and also eating habits. So yeah, excited to learn more. Why don't you tell us a little bit about yourself and your journey?
Well, great. So I am an RN and an advanced practice nurse, and I was a hospital-based nurse for 40 years. I started when I was very young, but I worked nights most of my career, and that's really interesting because now that I know what I know, since I went into studying functional medicine, I really think working nights, 12-hour shifts, I was in incredibly high stress jobs. I was a pediatric transport nurse, which was really exciting, but it took a toll on my health that I wasn't aware of at the time. And it was only when I started dealing with cancer and repeated diagnosis of cancer that I really needed to take a step back and look at, what was I doing, what was going on. And what became really apparent to me is, I was pretty well steeped in the medical system, traditional medicine. I was a pediatric ICU nurse for Boston Children's Hospital, for Stanford, for UCSF. So I was pretty well steeped in that. But during my second diagnosis of cancer, which was breast cancer, I kind of hit the point where I was having multiple complications. The doctors ended up saying to me, "We don't know what's wrong with you anymore. We don't know what else to do." I had already gone through 8 surgeries, numerous rounds of antibiotics, drugs, you name it. And I was not doing well. And one of my doctors said, "I don't know what to tell you, but you need to find something, because I don't have anything else to offer." And that was really shocking. And I'm like, "What do you mean? Medicine doesn't have anything else to offer." And interestingly enough, a series of events took me into, I had already, in my master's program, I had already studied like mind-body medicine, and through some connections that I had there and people who work in the field, I was introduced to the world of functional medicine. And I didn't really quite know what that was, but I kind of jumped in wholeheartedly because I was really looking for a way to fix myself. And I was also looking for a different career path, because I knew that going back to 12 to 14-hour shifts in a hospital was not going to be sustainable for me anymore. And I tell you, functional medicine completely opened my world to a whole new perspective of health and treatment that I didn't even know existed. And everything kept falling into place. And even to this day, I've been doing this now for 6 years. even to this day, I'm just learning all the time, just the interconnectedness of our bodies, and it's a completely different approach than we're taught in traditional medicine, which is very disease focused. It waits until you have symptoms and then it tries to eradicate the symptoms. And what functional medicine is doing is really trying to understand what's going on hormonally, what's going on in the body underneath that's causing you to get sick. And I have been able to help so many women. It's been really exciting. And I ended up specializing in breast cancer, not only because I had it, I'm not an oncology nurse, so it wasn't an area that I really was looking to go into. But when I start talking about some really basic interconnection, some basic foundations of functional medicine, all of a sudden, like people were listening and clients were calling me and coming to my office. I had an office one day a week and they're like, I've never heard this before. And I just started talking to people and no one else was talking about cancer from this functional approach, getting outside the surgery, chemo, kind of realm. So slowly I just kind of embraced it. I've specialized in it. It's all about hormones. And now I'm a functional medicine practitioner. I do some specialized testing. I work with people as a health coach. I do it particularly with the lens recovering from cancer, but I find that it involves every other system. So I'm just involved in really helping people understand their bodies, what's going on, what they can do to be in better health. And one of the things that you mentioned, it was really interesting. It was after I got into functional medicine. I was just new in my schooling. And within a month, one of the clients that came to see me had advanced, turns out I didn't even know what it was at the time, but she had advanced breast implant illness. So there's a whole syndrome that is surrounding breast implants. Breast implants are making a significant number of women sick. And as I just started doing some intense research to try to help her. She was having thyroid problems. She was, wasting away. She had sarcopenia. She had some really advanced problems. And I was frantically studying. And then, in a short period of time, this light bulb went off in my head. And I realized that's what had happened to me. That the whole thing that the doctors couldn't diagnose was actually an autoimmune response to the implants. And or the expanders. And once I got the foreign body taken out, that particular issue resolved. And it just really kind of grounded me in taking this functional approach to our health. And as I said, it's really about hormones and about hormone balance. And I think there's some specific things that are unique to nurses that would be good for us to understand and incorporate in our own health practice.
Mhm. Wow, that's an amazing story, and I'm sure you help countless women just from your own experience and your own research. I think that's what makes it even more useful, just going through things ourselves and experiencing and finding what works for us and
Right.
whatnot. So thank you for sharing that with other people.
One other thing that I'll add, it was really interesting. The day I really realized that there had to be another way, because as I said, I was pretty wedded to traditional, mainstream medicine, was when I went to my doctor and I was talking to her. They said, well, they were doing a surgery for my breast, and they're like, well, why don't we just go in and take out your ovaries at the same time? And I was like, okay, why?
Yeah.
What's the rationale for that? I mean, if it was indicated, I probably would have done it. And they were like, well, it's not really indicated, but we figure why not? Because they're not really helping you at this point anyway. I was menopausal, or they weren't sure I was menopausal, but figured I was. And they're like, well, why don't we just take it out? Because we don't know what else to do. And I'm like, no, I don't think so.
Yeah.
And that was when I realized that, once again, Western medicine, and, I'm not anti-medicine at all. It certainly has a place and it's needed, but it's just not the only way of approaching health. And I think when it comes to women's hormones, I think there's a lot of misunderstanding. They don't really have they're not really grounded in really understanding how complicated and interconnected women's hormones are and how it affects our health.
Yeah, wow. Definitely the healthcare system. It can be scary too. It is good to do your own due diligence, especially when it comes to your own health, and not just trust the advice of one person and get multiple opinions and do your own research. And
Right.
yeah, it could have gone very different for you.
The thing is traditional medicine, they're tools. I remember talking to a nursing instructor many years ago. She was getting her PhD in nursing. And she was telling this story about how people would ask her, well, if you're going to get a doctorate, why don't you become a medical doctor? Because then you'll be a doctor. And she said, because doctors treat diseases, and doctors wait for symptoms. They treat diseases. They actually study diseases. They don't study people. They don't study how to work with people. There's no way a nurse can treat somebody by looking at a set of symptoms. They're sitting down, they're looking at all aspects of their health. They're looking at their psychosocial factors. They're looking at their home environment. They're looking at their healthcare practices. She's like, nurses we work with people. We don't treat diseases. And that's what I want to stay committed to. And I've always taken that as my own, kind of philosophy about why I do what I do.
Mhm. Right. Yeah. There's multiple factors that can be involved, like diet, exercise, home environment, and things that people can realistically do too, like working with that.
Oh, absolutely. Absolutely. And, to go back to some of the things that I think uniquely affect nurses, diet is one thing. I mean, how many nurses work in situations where they don't even get official lunch breaks, or they get, you get 30 minutes and that's enough time to run down to the cafeteria, get whatever nutrition poor food they have, gulp it down and be back on the floor. And that's on a good day. There's, nurses are the first to be told, they don't have time to go to the bathroom. They don't have time for breaks. The fact that we work nights, working, we all have a natural circadian rhythm to all the hormones in our body. And when we're working nights, we're working against our bodies. Our bodies are set up to use nighttime to rest, to rejuvenate, to clear out toxins, to repair the body. And when we're up all night, and as nurses, we often are, you're kind of short circuiting some health practices for your body. And I personally was trying to lose weight, and I was talking to a doctor, and she said, if you're going to continue to work nights and if you're not going to switch to a day schedule, she's like, it's not going to be successful for you. And I'd really suggest that you look at, switching to a day schedule or whatever. And that sounded really radical at the time, but it turns out it's very true. So I think those are some of the unique things that we deal with in our profession that don't necessarily apply to people in other professions.
Mhm. Right. Yeah. That night shift can change everything with hormone disruption and weight gain and different things like that.
I remember about 15 years ago, and this was before I was in functional medicine, I read a report that said that nurses who work nights, long term, have a higher incidence of breast cancer. They have a higher incidence of heart attacks. They shorten their lifespan by about 10 years. And that's just what the medical system can measure. And, and it's actually more than just, kind of coming out with a statistic, which doesn't always penetrate for me. Now it's about really understanding why that is. And that's because of this hormone that, we have a circadian rhythm in our body. And when we're working against it, we're working against all of the hormones working together in our body to, and it doesn't have to be cancer or a heart attack. It's just feeling good or getting good rest or, women who work nights, they tend to struggle more with some hormone problems, like PMS and PMDD. And they have polycystic ovary syndrome is PCOS is kind of showing up in epidemic proportions. And they've shown a higher correlation between people who, work these unusual hours in PCOS. And it's nutrition and it's sleep and it's circadian rhythm and it's stress, and it's a whole, combination of things, but it's really important to the degree that we can to address what we can.
So it is great to be on the regular circadian rhythm schedule. But unfortunately, there are people that do work night shift. I mean, in terms of unfortunate, because it's not always possible to
Right.
have everyone just switch to days. Is there anything that you suggest, like for people that work night shift in terms of?
Well, one of the things that I noticed when I work nights with my coworkers is that, I mean, people work nights for a number of reasons. I did it just because I'm a night owl, which isn't particularly healthy, but I am. And but women did it so they could have more time with their families, be home with their kids. The thing that I noticed about people who work nights is they wanted to work all night, for whatever reason. But then during the day, particularly in the summer when it's nice weather out, they'd be like, oh, but my family's having a picnic at 1 o'clock and I've got to go home and sleep for 2 hours so I can be at the picnic. Well, what that just never made sense to me, particularly if you were coming back to work, because it's like, then you're working on 2 hours of sleep. It's like, it would be the equivalent of saying, somebody working a day schedule going, oh my God, my family's having a picnic at 2 a.m. and I have to be up and ready to be there at 2 a.m. And, just that devaluing of that need for rest, that need for downtime, on days I didn't have kids and I didn't have to struggle with their schedules, but like on my days, people would say, well, I never know when to call you. My friends would say, well, I never know when to call you. It's like, well, on days that I would work, I didn't take phone calls during the day. I went home, I slept, I would get up and try to cook, meals that I could take with me that were nutritious, and things. You working nights, you kind of have to take your meals anyway, but on the days that I worked, I was really committed to being on that schedule instead of trying to, oh, I'm going to get 3 hours of sleep and then get up and go to a doctor's appointment. And then I'm going to get another 2 hours. And then I'm going to go do this. And then I'm going to get another 3 hours. I think everybody's familiar with the concept of REM sleep. Well, when you're sleeping in 2 and 3 hour increments, you never get to REM sleep, which is really what you need neurologically and hormonally to really repair the body. So I think some of those things are if you have to work nights, some of those things are like blocking off 8 hours of time to sleep. And that's just as sacred as if you were trying to do it at night. It's like you don't get, go to bed at 10 at night and then get up at 2 in the morning to go to a party. But I noticed that when nurses work nights, they tried to do it all, and tried to meet everybody's expectations. And they can do it for a while, but I think they pay a price in their health.
Yeah, that's great. That's great tips. It is hard because there's obviously a lot more events during the day. So there'll be times when they miss out on certain things, but trying to schedule around that if possible, or
Right. Right. And the other thing that I have to say, just plain and simple, is that if people do need to work nights, to do it for the least amount of time as possible. There may be a time, that, for a couple of years, you choose to work nights, and yeah, it's easier when you're younger. You can rebound faster. But like in my case, I did it for over 30 years and I should have stopped long before I did. So if you do need to do it, I would just say do it for as short a period of time as you can. And, I'm sure things that are consistent with what you talk about in the group is really looking at finding a professional path that you find fulfilling, one that you want to do. Maybe that, for me at the, now I sit there and I think, wow, a clinic job, I should have probably looked at a clinic job. It had more normal hours and I probably would have enjoyed it. But at the time, I didn't want to give up the adrenaline pumping of working in the ICU. So one of the things that I'm very passionate about is really encouraging nurses to find that area or that specialty that they enjoy and then pursuing that with everything that they've got, instead of just doing a job to do time, because I think nursing just takes too much out of us. I really, there's incredible opportunities for nurses. They're not all based in a hospital. They can be in clinics. In my case now, I'm an independent practitioner. I work from home. There's growing opportunities for nurses to do that. So I think that another thing is finding an area that you really enjoy, that you feel passionate about, because I think most people who go into nursing are very passionate people, and they're there because they really want to do something that resonates with them, not just, for financial reasons. So I think that that's finding something that really gives you that gratification is really important.
right. Yeah, there's so many options out there that also didn't exist, back in the day.
Yeah,
A lot of
definitely.
things to explore. Yeah.
Definitely. Yeah.
What are some other ways that people can help with hormone balance?
Well, I'd like to talk a little bit about kind of what hormone balance means, because honestly, I didn't really understand this until I went into functional medicine. And traditional medicine, I don't really think they've got a good handle on women's hormones. I don't think and then when there's problems, I don't think that what they're offering helps a lot of times. So, anybody listening to this, please put in a question if you have a specific question, or afterwards if you want to contact me. I'm certainly available for that too. But I think it's really important to understand hormones. Hormones, well, medicine in general. Whenever you treat something, say you go in because you have a gallbladder problem. That's a very common thing. Another organ they like to just routinely remove, whether they know it's going to make a difference or not, which I'm very against now. But they go in and doctors write prescriptions for that, or you have reflux, or you have insomnia, and they have their toolbox involves writing prescriptions, but they're not looking at what that's doing to other aspects of your health. When I work with clients, I talk about it as a whack-a-mole system. You go in and the doctor's trying to hit the one little gopher that's popping up, but what I'm looking at is the other 5 holes that the gopher is going to pop up in. And I think that that's a way that I think about hormones is that, like say something as common as taking birth control pills, which is the easiest and probably most common form of birth control. Well, they're looking at it because it achieves one particular thing, which is, preventing pregnancy, or they use it for a myriad of other things. But traditional medicine doesn't look at what it's doing to the other hormones in your body and how it might pop up in other ways. Actually, birth control pills are one of the biggest problems in terms of reaching hormone balance that we have, because like birth control pills, they're not hormones. What they are is hormone disruptors. What birth control pills are doing are actually interfering with your normal hormone production. And so they're disrupting that pattern, and it shows up in other ways. And so when you have problems losing weight, or it's often comes back to being in a state of what they call estrogen dominant. Birth control pills are a major contributor to estrogen dominance. Estrogen dominance is probably the most important hormonal health factor that women before menopause need to deal with. Women after menopause still need to deal with it, but they're also dealing with menopause symptoms. And when women go through menopause or perimenopause, which actually is happening earlier and earlier, the thing that got my attention is that women are going through perimenopause sometimes in their 30s. And breast cancer, which at one point in time was considered to be an old woman's disease, as they were in menopause, is actually being diagnosed younger and younger. I have actually personally worked with clients as young as 28 and 31 who have been diagnosed with breast cancer.
Wow.
So when you look at what they often do for breast cancer treatment, which is blocking estrogen, that's what the drugs do. They're estrogen blockers. Well, that's one thing. If a woman's in her 60s or 70s, it has one effect, not necessarily one that I'm overly supportive of. But my question is, what is it doing to a woman at the age of 31 that you're putting a 31-year-old woman in menopause so that you can treat her with these quote unquote cancer drugs, which increase the incidence of other health related issues? So when it comes to trying to understand what's happening hormonally, this is such an important primary issue for women to wrap their heads around, to really look at hormones and how that's acting in their body. About 15 years ago, before I went into functional medicine, I was listening to an NPR interview with a doctor. And I found this really interesting. I've never forgotten it. He said that the generation of women behind me, so I'm 59. So the women who were in their 40s was the first generation of women who had been treated with birth control pills so early in their lives, oftentimes as early as 9 or 10 years old, because birth control pills in that they're not only given for birth control, but they're given for acne, they're given for a whole lot of other things. And he was saying that women who would now be in their 40s and women younger than that have been basically their entire hormonal rhythm. They've never been able to establish their own circadian rhythm because there's a whole group of women that it's always been controlled by drugs, either birth control pills or hormone replacement. It's just one thing after another. And he really felt that had some really significant and detrimental effects on women, including their eventual risk of cancer. Because what they're looking at is there's a lot of factors that they think are at play when it comes to cancer. but one of them they're looking at is your overall lifetime exposure to estrogen. So if you're starting estrogen, it's not even real estrogen, but if you're starting estrogen mimicking drugs at the age of 10,
Yeah.
as opposed to at one point in time, it used to be like, 15, 16, that gives you that many more years where you're exposed to high doses of estrogen. And he really felt like it played a large role in cancer and some of the hormone issues that women are getting when they get older.
Wow. Yeah, interesting. Yeah, so many women are on birth control, and they, yeah, I mean, if possible, of course, trying the natural route to treat certain conditions, or look at the
Well, the thing
underlying
is
root.
that they're so pervasive that people don't even raise, a concern. They're like, oh yeah, birth control pills, but they have
Mhm.
really profound effects.
Right.
And, as I said, estrogen dominance takes a lot of different forms. And so we've talked a little bit about the theory, but let's talk about practical aspects. Issues like losing weight are particularly related to your estrogen balance. If you're having trouble losing weight, regardless of what you do in terms of exercise or diet, you're probably looking at a hormone imbalance.
Mhm.
Women who have PMS or PMDD, which is a bigger syndrome around their periods, are looking at estrogen dominance. Women with cancer related, hormone related breast cancers, it's being traced back to this estrogen dominance. There's a phenomenon that maybe your viewers are familiar with it. It's called being skinny fat. So like when you look at somebody, they don't look fat to you, but if you looked at their percentage of fat to muscle, like if they have the muffin top above their jeans, that's referred to as skinny fat. So they actually metabolically have the same thing going on as somebody that you would look at and think was objectively obese. But chemically the same thing is happening. They're probably insulin resistant. They're eating a high carbohydrate diet. They probably are on some scale of insulin resistance leading into pre-diabetes, which eventually leads to type 2 diabetes. That's all on a spectrum. And so as a functional medicine person, if I can come in and help someone understand that, earlier on and kind of reverse that before they get to cancer or before they get to type 2 diabetes, that's like the ultimate goal. Um,
Mhm.
so that's the way a lot of women might experience it. I'll tell you a really quick story. I had this woman, was very new in functional medicine, but since hormones was, kind of the thing that I gravitated towards, it kind of fell into place. But I had this woman come to me in my office, young woman. She was like 35. She was a professional. She hadn't had kids. She was probably about 50 pounds overweight. She came to me after she had gone to her regular nurse practitioner, and because she had excessive bleeding, like she would bleed very heavily, like 20 days a month, and then have 3 or 4 days off and then start bleeding all over again.
Mhm.
And I mean, in addition to, the whole aspect of bleeding, I mean, she was just a mess. She was very emotional. And her regular doctor, nurse practitioner, women's health specialist, whoever she was seeing, was like, well, I don't really know what's wrong with you. So why don't we work you up for having cervical cancer? And
Mhm.
I was like, wow, these aren't the traditional signs of cervical cancer.
Mhm.
Uh, they're signs of PCOS, but they're not, excessive constant bleeding for 20 days is not a first sign of cervical cancer. But this practitioner had done 2 colposcopies, which is taking a section of the uterus to work up for cancer, had found nothing, but still wanted to do a hysterectomy.
Oh.
So the woman, the young woman came to me, and she was just in tears. She was getting engaged. Of course, that meant she was not going to be able to have children, which was the first session that we talked about. And I felt so strongly that she had this PCOS dynamic going on. And I said, well, I'm not telling you that your other provider is wrong, but why don't you work with me for a couple of months, and let's implement some of the things that I've learned to do for this. Because if there was a definition of PCOS in the dictionary, your picture would be next to it. So
Mhm.
work with me for a little while and see if we can reverse this. And then if we can't, there's always surgery. And she did. She made that leap of faith. So we started talking. We really looked at her diet, and really looked at getting a lower glycemic diet, and which means really cutting simple carbohydrates, and it's much, and increasing protein. There's a lot to it. But anyway, we looked at her diet. I got her on some key supplements. And to tell you the truth, for the first month, it was slow going and things were getting worse. And I was kind of wondering, are we on the right track? And then I remember one day she called me on the phone. It was probably about 6 weeks in, and she called me on the phone. I hadn't seen her in a couple of weeks, and she said, "Oh my God, today I just went 17 days without bleeding for the first
Wow.
time in 5 years." And I was like, I was ready to jump up and down for joy, and she was. And I was like, wow. So it took a little while for those interventions to engage. So we also, one of the things that's highly associated with PCOS dynamic and with hormone imbalance is a sluggish thyroid. So when you take it to a doctor, it may not look like your values are out of the norm, but you're still not functioning optimally. So we got her on some nutrients to support better thyroid function, which was giving her better energy. We talked about sleep, which was helping her cortisol system. We got her on a diet that worked for her, which was really a challenge, because one of the things to help with hormone regulations is really decreasing simple carbs in your diet. But at the time I lived in Hawaii, and in Hawaii, rice is a staple of the diet. So it was very hard to like look at, like going to family potlucks where, they'd have poi and rice and rice and rice and, and so it was a real challenge to look at that, but she was really committed to it. And within, I'd say 2.5 months, she was having normal cycles. She was looking at getting pregnant. She just was happy. Her skin was getting better. She had some dry skin, some other signs of thyroid problems. Another thing when you have imbalanced estrogen is that estrogen is really critical to proper thyroid function. So people who have an imbalance of estrogen frequently have a thyroid dysregulation. So the ability to dig deeper and to address those things really made a fundamental difference in her life. And it was so gratifying that I could give her that in basically about 2 months. But it made and in addition to that, going forward, I don't continue to see her now, but I think she had a better understanding of her body and her hormones. So she didn't need me around, forever. She just needed me to kind of teach her about what was happening in her body, and she's been able to maintain it.
Yeah. Great. So her diet and fixing the thyroid were some of the main
I think
things.
if there are some core principles, it would be, I was thinking today when I was looking through my material, everybody's heard about the ketogenic diet. Ketogenic diet is really popular right now. There are reasons that helps with hormone balance. I don't necessarily know if everybody has to be pure ketogenic, which in and of itself is pretty hard to do and maintain.
Yeah.
And not everybody responds well to it. There isn't one diet for everyone. And some women in particular, because we have this hormonal interplay, need B vitamins. And so sometimes a ketogenic diet makes someone feel really weird. So it's not necessarily the best diet for anyone. But I do think that understanding the importance of a low glycemic, low carbohydrate diet, like with a carbohydrate total between 50 and 75, is really helpful to women. It can really help in weight management. If you're doing ketogenic, they want your carbohydrates below 20, which is really, really stringent. But it's the best way to balance your hormones, having good protein, having good fats in your diet.
Yeah.
We eat a lot of unhealthy fats that have multiple health problems. So basically, eating fats. Butter is actually a healthy fat. Butter, coconut oil, avocados, olive oil. But the yellow stuff that sits on shelves and bottles is probably the worst stuff you could be using.
Nuts, olives, yeah.
Right, olives, and nuts, but looking at that, I think most people in general, what people understand about nutrition comes through the lens of how to lose weight. And all of these diets and losing weight is not necessarily healthy for you, nor do these diets necessarily promote healthy macronutrients. I've been on, some name brand diets, one of them like being Jenny Craig. And I think the only thing I was eating on that were simple, they were frozen foods, but it was like rice and pasta, but it was just small quantity. And now that I understand Like, oh my God, from a nutritional standpoint, there wasn't a lot of nutritional value to that. And so I think if there's one thing that people can do is really really think about your relationship to nutrition and food. And particularly for nurses, are you eating on the run because you're working 13 hours and you don't have time to prepare anything? That's a pretty common scenario. So you're eating at the cafeteria, which notoriously the food doesn't taste good and it's not nutritious for you. So kind of troubleshooting nutrition is one thing you can do. Another thing is really prioritizing sleep. We, in our culture, we underestimate what stress does to us, and we devalue sleep. Sleep, people say, "Oh, well, I'll sleep when I'm dead." It's always like, well, if you don't sleep, you'll be dead sooner than later.
Yeah.
We need to rethink sleep. I mean, I have a whole handout that I give clients, and if anybody is interested who's listening to this, I'll send it to you if you let me know your email. But it's called Sleep Hygiene. But really getting into a supportive sleep schedule is one of the best things that we can do for our overall health. Learning to manage stress, and this is where I think your group comes in. Things like including simple meditation, or including a breathing exercise, a 5-minute breathing exercise 2 or 3 times a day, is incredibly beneficial to just turning down the volume, of all that noise that keeps us kind of in this hyper fight or flight adrenalized state, and teaching our bodies to turn off the adrenaline flow so that you can go into the other state, which is what they call rest and digest, kind of tells you the benefits of it. So those are some things that I think anybody can do, regardless of what additional health issues they might be dealing with.
Yeah, those are great habits to have.
Right.
We talked before about a little bit about adrenal fatigue. Can you talk a little bit about that?
Oh, I could talk a lot about that, but I'll try to condense it. So, this is really interesting because when it comes to the world of adrenal function and adrenal fatigue, medicine doesn't even really deal with that. They deal with it if you have Hashimoto's, which is low thyroid with an autoimmune component, or Graves' disease, which is hyperthyroid. But our adrenal function is central to our immune health. It's central to our emotional health. It's central to our hormone health. Our adrenal function is kind of the foundation that everything is built on. As a matter of fact, when they talk about hormones, because you're not looking at like targeting one thing, what they refer to is the HPATG axis. And I'm sure your listeners are familiar with that. The hypothalamus, pituitary, thyroid, adrenal, and gonad. But it all comes together like in a symphony. And the adrenal health is core to that. So in addition to the fact that our adrenal glands secrete a certain amount of cortisol, it's kind of like the bucket. This is how much you have to work with in a 24-hour period. I do a specialized form of testing. It's called a Dutch test, which is a hormone test that women do at home. And then I get the results and we look at all their hormones, but including their adrenal hormones. So on a Dutch test, I can see how much cortisol you're producing. So even if someone's got healthy adrenals and they're producing a good amount of cortisol, the second step is looking at the circadian rhythm of how cortisol is used in the body. There's a natural rhythm that your cortisol, like you should be getting a boost in the morning, when you need most of your energy because you're getting prepared for the day, and then it tapers off. So you have some, but less in the afternoon, and then it should be lowest at night. So you can go to sleep, because high cortisol does not allow you to sleep. I can't tell you how many women have 0 in the morning or very low functioning in the morning, and they're high at night, myself included. My first Dutch was like scary for me to look at because mine was highest at night, but I had spent 40 years revving myself up at night. So
Right,
that's what my body was doing. It was shooting cortisol at night when it should be low. So now that I don't work nights, it's still a challenge for me. It should be highest in the morning. It's not only about sleep, but it's also about weight regulation, about energy, about fatigue. It's all these other things that we've been talking about. So in the presence of high cortisol, or it being used at times of the day that aren't serving you well, you can get into something called adrenal fatigue. So the early phases of adrenal fatigue, I mean, if you think about it, like it's like having a hyperactive child. In the early phases of adrenal fatigue, like that morning cortisol that should be high is like off the charts. And then they crash in the afternoon and they need like a nap. And then, they go up again in the evening. That's a very common adrenal profile, but it's not one that's probably serving most people well. And that's considered an early phase of adrenal fatigue where your adrenal glands are trying to pick up the slack, secrete more cortisol to meet the demands that it perceives you're putting on the body. Well, you can only do that for a certain amount of time. As nurses will know, we all have great compensatory mechanisms, and our bodies are great at compensating until they don't compensate anymore. And when they reach that point, that's when you see disease take over. This happened in kids all the time. They've got a great, you get a kid can be breathing 80 times a minute. Well, they're compensating, but when they can't compensate anymore, as they get sicker, they just stop breathing altogether. That's the challenge. And it's the same thing with the, our bodies are trying to meet the demands we're placing on it. And so it goes into oversecretion, but it can only maintain that for a certain amount of time, and then it crashes. So as it crashes, that's where you see what they call more advanced adrenal fatigue, to the point that, like with some of the women that I work with who are dealing with cancer, lots of stresses, depression, sleeplessness, drugs, chemotherapy, they can just have a flat line. So they're getting no adrenal support at all. That has direct effect on our immune system. Our ability to even mount an immune response is highly related to our adrenal system. So in a way, they're actually, they are behind the eight ball, because they, of course, when you have cancer, you need a robust immune system, and they've got nothing boosting their immune system. And so it can be really a challenge to turn around, but it's a really important thing to address. And I think nurses, because of the hours that we work, because of the length of time that we work, the stress of the jobs that we do, I think we're assaulting ourselves with high, when people start using coffee and things to get that surge, what you're trying to do is prop up your body when your body is telling you, I need a rest. And so I think this is particularly important for nurses to understand, to look at their adrenal health and to look at ways to maintain as close a proper circadian rhythm as possible.
Mm.
It's one of the things that I can go down the rabbit hole with, because it's one of the areas I love to work in. But but the reason for that is because I was one of the worst offenders as a nurse. Understanding this piece was probably the most important piece of my own recovery. Realizing that I've had numerous cancer diagnoses, and I had a flat adrenal curve. I still work on it, and I know all of the things to do, but it's almost like my body is I've trained my body after 40 years of what I did. My body is very quick to go to that. So I have to be very precious about making sure, if I'm not careful about it, and if I'm studying something or watching TV, I can very easily be up till 3 a.m. And I tell my clients, like, absolutely, you've got to be in bed before 11 and 12. And here I am sitting at 3 a.m. sending out emails. I have to be very careful in my own recovery, because it's so important. One of the things that people can do to really support that, there's a whole interplay of melatonin, which has some really fascinating effects on our body. I'll tell you a quick anecdote. It changed for me. Like I said, I had been working nights happily for many, many, many years. A few years ago, I decided I wanted to raft down the Colorado River as a vacation, which was an awesome experience. I loved it. It was awesome. But the thing is that, we would be up at 5 a.m, which I used to tell people, the only time I'd say 5 a.m. is if I stayed up all night. But we were up at 5 a.m. We were on the river. We would pull off, at natural, when the light was going down. But in Arizona in August, that was like at 7 o'clock at night. So generally about 9 o'clock at night, it would be pitch black, and we were out, we were rafting the Colorado. So we didn't have any artificial lights, no computers, no TVs, no cell phones, no nothing. It was just us and nature. I even took a flashlight, because the only thing I wanted to do was read Harry Potter, the last book of Harry Potter. So I took a flashlight with me. It was so black in the middle of nature that it would even swallow up the light from the flashlight. I couldn't even see the words on the page. So I just finally gave up. So when it would get dark, I'd lay in my sleeping bag, I'd look at the stars, and I'd go to sleep. doing that for 1 week. 1 week, I came back. I was naturally getting up with natural energy at 5 in the morning. I was ready to be in bed at 9 o'clock at night. And from that day forward, from that week forward, I went back to working nights. I was never able to put my body back into sleeping during the day and staying up all night. I struggled with it horribly. It's like even that 7-day period was enough to reset my circadian rhythm. But that was, but it wouldn't have been the same had I been at home working on my computer. Computers and TVs and laptops and phone all secrete a kind of light that tells our brain to be awake. So it wouldn't have even had the same effect if I tried to be at home trying to reset my sleep cycle. It really took going to the middle of nowhere when I had no other option but to sleep according to, according to what was going on outside, that my body did that hard reset. And I remember coming back. I mean, then it was really bad because then I was up all night for work and I couldn't sleep during the day. And I think it was a matter of like weeks before I took a day position because I couldn't do it anymore.
Mhm. Wow. Well, I think, nature as medicine and treatment would be
Yeah.
great to prescribe
Yeah.
that. Here, take a week in the forest
Yeah.
in the middle of nowhere.
Go to some place like Harbin Hot Springs or one of the hot springs in California. I
Yeah,
used to
I've
go to
been
Harbin
there.
Hot Springs. Yeah. There's lots of ways to do it. Go camping, for a few days and, but just kind of listen to your body. And it's amazing to me how quickly your body will reset, but in our modern world with all the stuff we've got going on and all the toys we have, we're kind of forcing an unnatural situation on our bodies. And we're struggling to keep up. And when we're struggling, that's when we're getting into all these imbalances and sometimes even resulting in actual illnesses and diagnoses.
Mhm. Right. Yeah. Human beings have added all these extra things, infrastructure, processed food, and electronics that weren't around. Back
And
in
we're
the
getting
day. So,
sicker and sicker, you
yeah.
know. That's why, my friend and I, we laugh. It's like I've become the person I kind of made fun of 20 years ago. But the fact is that, yeah, it's great we have all these conveniences and, certainly life is a lot better, easier for me. My mother didn't have the option of stopping and picking up a cooked chicken at Costco when I was a kid, and so for those conveniences, that's why we're paying with some of these lifestyle illnesses, which tend to be chronic. But I think with some consciousness and with some awareness and some intention, we can certainly minimize a lot of the wear and tear we're putting on ourselves that's not necessary, and by result kind of eliminate some of these illnesses that are becoming so pervasive.
Mm, yeah. Yeah. Great. Great tips. Any other? We're almost at the hour. But
Almost.
any other things you'd like to mention or share?
Let's
There's
see.
a lot of great information.
Yeah, there's a few things. Vitamin D is actually something that you hear about in the news a lot. Well, vitamin D is not a vitamin; it's a hormone that has hundreds of like signaling potential in our body. Vitamin D is something that medicine really doesn't understand, but I really work with people. It doesn't matter what climate you live in. I grew up in Arizona and I still had a chronically low vitamin D level. One of the best things you can do is get your vitamin D level, which you can have checked by blood work, above 50. So that
Mhm.
requires supplementation for most people. But even in Hawaii and Arizona, I still had chronically low vitamin D, but they feel like that has a lot to do with hormone balance. It has a lot to do with cancer prevention. It's particularly important in breast cancer prevention. It has particular action on breast cancer cells. It supports your immune system. I mean, they put the president of the United States on vitamin D to treat COVID 6 months ago. So I think it's kind of hit the mainstream that we need vitamin D. But in terms of supplements like vitamin D and zinc are pretty important to hormone regulation and homeostasis. As I said, if anybody's interested in learning more, there's articles written about estrogen dominance. So if you're struggling with any of these issues that I talked about, do a Google search and start reading about estrogen dominance. It'll kind of open your eyes. The other thing we didn't talk about when it comes to food and nutrition is the first thing you can do for estrogen dominance is this is the reason they recommend organic food, because we want to get away from food that's sprayed with pesticides. and we want, which is really the biggest thing about organic foods, but really getting away from a lot of our traditional food supply is hormone laden. So really understanding how that shows up, like drinking fluid from plastics, like soda bottles, has BPA in it. It's a huge endocrine disruptor, huge contributor to estrogen dominance. So there are some really simple things that people can do that's, just is going to move that needle to the healthier side than the less healthy side. So, but straightforward things that people can do. Just, Google and read about estrogen dominance, and you'll be amazed what kind of information you can find.
Mhm.
And if any of you are dealing with breast cancer or concerns about breast cancer, that's kind of my jam. So, please feel free to contact me. I can, there's a lot of prevention, a lot of stuff around breast cancer specifically that's probably too much for the podcast. But if it's something that you're dealing with, or you have a family history and you have concerns about it, that's certainly the area I work in, and I'm certainly available as a resource.
Yeah, great. Thank you. That's such a valuable resource. People with breast cancer may, they benefit from getting another opinion from you, because another, Western medicine, as we discussed, may not give you all the answers that you're looking for, or look at it from a different perspective.
Well, what I tell people when they come to me, including my best friend who had Crohn's disease, I was helping her through Crohn's disease. They wanted to do surgery. And, what I said to her is, like, even if all the stuff that I work with you on fails, they'll still do surgery. It's always available to you. They'll never take surgery off the table if that's what they're recommending, but this may be a way to avoid that. And, especially in the world of breast cancer, there's women who get prophylactic mastectomies because there's a strong family history. And if there's anything that you can do before having a part of your body amputated, I think most people would want to know what that is. So if that's the choice that women make, they want to go that route, it's a very personal choice, and I don't have judgment about that, but there's a whole lot that we can understand and do before we get to that ultimate difficult decision.
Mhm. Well, thank you so much, Deborah. I'm going to share your information on
Please do.
the chat, and also on our website, www.mindfulnurses.com. And we'll repost this also. You'll see it on YouTube and on Instagram as well. But yeah, let us know.
My website, just to let you know, my website is www.boobsaren'tworthdyingfor.com. And I also have a podcast by the same name, Boobs Aren't Worth Dying For. So if you're interested in learning more about functional medicine and this kind of integrated approach, I've had the benefit of interviewing some leaders in the field. I've been really fortunate that these women have given me their time and done interviews. And oftentimes I'll just get emails from people who ran across the podcast, and they're like, wow, they just, open their eyes to what an integrative functional approach to your health can do. It is certainly geared towards breast cancer, but it talks about hormones, it talks about Dutch testing, it talks about all these things. So if it's something that interests you, you can find it on Facebook. You can find it through my website and YouTube. It's available. So if it's something. And one last thing, if there are any nurses out there who are interested in looking at functional medicine as a career path, this is something I'm passionate about. I believe nurses need to be at the table. We have so much to offer in terms of our knowledge, our experience, and our training. And I love empowering nurses to look at what they can do that gives them professional satisfaction, a good income. I got to the point where I didn't want to work in hospitals anymore. And I'm so glad that I'm able to work independently. So if any of your nurses have questions about looking at functional medicine as a career path, it's another thing I love to support nurses to do, because we need more of us at the table sharing this information. It always doesn't have to come from doctors. We're trained, talented professionals, and we should be having a voice at the table as well.
Right. Yeah. Thank you so much for sharing that. Yeah. Functional medicine is a very important field to get into, and really interesting to find the root causes of things, looking at things that Western medicine doesn't really put a microscope to.
No, they don't. They don't. It's not either or. I think I consider myself that it's an asset that I can bring my traditional medicine to the table. As I tell people, if somebody's coming in and they're having a heart attack, I know I know enough to send them to an emergency room. I'm not going to treat them with a supplement. So I think having the strong clinical background that we have is a great foundation for looking deeper at the more functional and integrative aspect of it. I don't think it's an either or. I think it all comes together really beautifully.
All right. Well, thank you so much, Deborah, and thank you
Oh,
everyone
thank
for
you, Claudia.
tuning in.